Hello, welcome to our session where we're going to look at professional ethics and code of conduct for nurses and midwives in Kenya in the care, management, and prevention of FGM. My name is Winnie Barawa. If you're new here, this is a channel that looks at lectures, lessons, and expert interviews pertaining to healthcare. And in this series, we are conducting a sensitization against FGM in partnership with University of Nairobi, the Girl Generation, and ACAF, which in full stands for Africa Coordinating Center for Abandonment of FGM. So stick with me all the way to the end, and if you're new, not yet subscribed, please subscribe and give us your support. So in the previous video, we looked at professional ethics and code of conduct for doctors. When you look at the different acts, we looked at the Hippocratic Oath, and we also looked at the Helsinki Declaration. So for the nurses in Kenya, we shall explore the Nurses Act, which is an act of parliament that helps us in establishing the mode of conduct and code of conduct that governs the behavior of nurses who are practicing in Kenya or in the different parts of specialties. So the Nurses Act contains provisions that are going to govern our healthcare workers who are offering nursing or midwifery services. So under Section 18A of the Act provides for practices that constitute a professional misconduct among nurses. So it provides that in subsection F provides that a registered nurse is culpable of professional misconduct if that nurse fails to observe and apply professional, technical, ethical, or other standards are prescribed by the council as guidelines for the practice by the registered nurses. So this act comes into place to provide a landscape of operation, like how nurses should professionally handle themselves, be it in the professional setting, in public, or in different setups where they'll be offering these services. So we have nurses associations, and in Kenya we have the National Nurses Association of Kenya, which is a member of the National Council of Kenya. So the National Council of Kenya is like the body that encompasses guiding and regulating the nursing practice of Kenya. So it's among the council that it gets to publish the code of conduct and ethics for nurses in Kenya. So the code provides that the nurse's primary responsibility is to endeavor to help people attain, retain, and regain their health. So it provides that for nurses, as they provide their responsibilities or as they implement their responsibility, they need to ensure that they maintain the well-being of the community. And in that case, FGM being a practice which is performed has negative effects on the woman's health or the girl's health. And so under the Nurses Act, it is categorized as an unethical conduct. So any practice of FGM, any practice of mutilation of the female external genitalia, then we are considering that a misconduct, and therefore under the Nurses Act, the nurses can be held liable before a court of law, or they can be issued disciplinary measures from the Nursing Council of Kenya. So continuing with the Nurses Act, exploring on the aspect of medicalisation, because we have explained that currently the new trend in FGM practices is the medicalisation. So we are told that medicalisation goes against professional ethics and is a violation of the code of conduct for healthcare providers. This is because FGM generally entails cutting of the healthy tissue for non-therapeutic reasons. For this case, if any nurse is caught in the act of practicing medicalisation of the FGM, they get to be liable to be held accountable and to be implemented on any disciplinary measures. So they are procedures that are held important when it comes to FGM, and one of it is defibrillation. So we've done a whole videos about defibrillation, and you can just refer back to just know what is it, when do we prepare a patient for defibrillation, how do we manage her after the procedure. So the defibrillation is that procedure of opening up infibulation cut, that is type 3 of types of FGM. So when you go to open the woman up who was already sutured during during type 3 FGM, then that procedure we are doing is what we call de-infibulation. Now, the act of closing it again after we have already opened it, we are calling it re-infibulation. So re-infibulation is a misconduct, or rather it is unethical. So we are told that it is important for healthcare providers to understand why the former is necessary and should be performed, and why the latter in this case is the re-infibulation, will result in mis will result in professional misconduct. So it's provided that any nurse who is caught practicing re-infibulation under the Nursing Act can be held liable in a court of law. So provisions for pre-FGM care for purposes of limiting adverse effect of FGM can actually be treated as a misconduct. What do we mean? If a nurse is caught in the act of bathing or assisting or aiding the practice of FGM, like finding a client who has undergone different types of FGM and you're offering post FGM management or pre FGM management so that the client, let's say, doesn't get complications, or you feel they can feel less pain. These interventions, provided they are not undoing the act of FGM, or rather they are promoting the practice of FGM, then this nurse will be treated as a professional misconduct and is held liable in a court of law. So next is how WHO policy guidelines come to guide the professional conduct of nurses. So under the WHO policy guidelines, which is a second angle that you can look at it when looking at the ethics and code of conduct. So WHO policy guidelines for nurses and midwives has 5 policy statements. And in one of these policy statements, it says that nurses and midwives should actually open up type 3 FGM. And this is where now infibulation, re-infibulation can take place. So when you find type 3 FGM, we also called it infibulation. So a nurse is allowed to open up that type of FGM, and in that case, we call that procedure de-infibulation. However, as a nurse, we are not allowed to close de-infibulated type of FGM. Once we open, we're supposed to leave it open like that and not to resuture it back. So in the second policy statement, according to WHO policies for nurses, it says that nurses and midwives should refuse request to restitch an opened up vulva, which is now what we call re-infibulation. So once we de-infibulate, we are not allowed to re-infibulate. We're just supposed to nurse the client until her wounds get healed, but we should not at any moment try to restitch back the lady or restitch the external genitalias again. So progressing again, going further into the guidelines for nurses and midwives on the policies, we have policy statement 3, which says that nurses and midwives need to be trained so that they are able to perform functions which were traditionally outside their legal scope of work, so that they're able to provide comprehensive care in the cases of FGM. So you find that certain procedures in the healthcare practice were a little bit limited to particular cadre of healthcare workers. For example, in the case of episiotomies, prescription of antibiotics or analgesics, these were prescribed specifically either from the pharmacy side or prescribed by the medical doctor. But then with the need for interventions in the case of FGM, we are now opening up more functions for nurses so that they can provide comprehensive care. This is like the right to offer the infibulation service, performing or giving an episiotomy, prescribing antibiotics, and even analgesics. This is for the purpose of infection prevention, preventing management of pain, or even basically opening up the woman so that she doesn't risk further complications due to an opened vagina. Then we have statement number 4, which says that nurses and midwives should routinely note the presence of FGM and related complications, and health information system should include appropriate data on the FGM. So this now is looking at nurses becoming in as part of the monitoring and survey team when it comes to tracing contact cases of FGM. So what this means is there is more role for nurses to play, that in the case of screening an FGM case, then we need to provide adequate and appropriate information around that FGM case. So this now is looking at data harvesting or data harnessing so that we can have it well documented in our patient receiving books or patient data control books. Then you have number 5 statement. This one now looks at nurses and midwives must be expressly forbidden from performing FGM, and any nurse or midwife who perform the practice should face professional disciplinary action or legal action. So this statement emphasizes the impact of malpractice or the consequences of conducting FGM or practicing in the FGM as a nurse. So these are policies put in place to just emphasize on the need of healthcare workers, particularly nurses and midwives, in just avoiding conducting FGM, which is a malpractice or it's a misconduct against the human rights of women and girls. So this brings us to the end of our lesson. Thank you very much for staying with me all the way to the end. I really love it when you just like our videos, you give it a comment, like letting us know what you love most, sharing in your platform so that people can learn from this, and then give us a subscription. Just click on the subscribe button if you like this channel and you want us to grow. So thank you so much, and until we meet again in our next lessons, bye bye.